You are watching the Doc Talk Show.
So, Dr. Kasiri, before we went for the break, we're talking about COVID-19 and sickle cell disease. Is there any link between the two, and should we be worried?
Thank you very much. Just like we've been advised and probably witnessed COVID to be a global pandemic, it's real, and that concerns all of us, whether you have sickle cell or you don't have sickle cell. We're all at potential risk. What would put our clients, warriors, at more risk is that sometimes they have chest complications.
Okay.
And therefore, if you brought COVID into the picture, it will potentially worsen
It will now be
the picture, the outcome. Secondly, sometimes they have already, we've talked about the risk of blood clogging, the small vessels. So if you bring in COVID again, knowing that it has also been associated with clogging of vessels or clot formation, so that can potentially, okay? We have not completely understood or examined what COVID could do, but if you look at what sickle cell and what COVID does,
the kind of related.
the combination can potentially be catastrophic.
So what should parents do now?
So just like the government has already stressed, we should all observe the preventative measures, okay, to the bone. And more so for this patient with sickle cell, we should also adhere to the preventative approaches like drinking adequately, like she's mentioned, avoiding extremes of temperature, extreme cold, extreme hot, heat, adhering to the medications, the preventative, the penicillin, the folic acid, the malaria prophylaxis, eating a balanced diet, and then attending your facility or clinic regularly.
So those prevent the sickle cell.
Yes.
Or at least not preventing sickle cell. They improve the
quality of life
of someone with sickle cell.
Yes.
So then there's also preventing the COVID, because up now take extra precaution.
Yes.
Wearing face mask,
Yes.
sanitizing, hand washing, social distancing. All these are meant to reduce the risk of getting the COVID disease, reduce the risk of increasing the burden on someone who already has sickle cell disease. We don't want them to get problems with their chest because they already have some other complications. I don't know if we'll have time to talk about it. But we don't want to add more complications on so many other complications. Therefore, it's important we take precaution in preventing ourselves from getting these diseases, such as COVID. It can even be malaria, or it can be any other disease. That's why immunization is important. That's why going for care, for checkups is very important, so that you can live a healthy and normal life.
You are watching the Doc Talk Show.
I'm called Wesivade Safina. I'm a student at Islamic University in Uganda, Kampala campus. Currently, I've been working with Red Cross and volunteering with Uganda Sickle Cell Rescue Fund. And sometimes I do some cakes and some art pieces. I got to know about sickle cells when I was 6 years. That's when I realized that I've got an attack, and I was later rushed to Mulago, and I had to be transfused. So when I got transfused, it was still hard on my mom because she used to cry a lot, and I could ask her, like, "Mom, why are you crying?" She could tell me, like, you have sickle cells. But by then I didn't really know what sickle cell was in details. I had no idea. So I was just blank. And then I just moved on with my life. So I went back to school. There is a letter they gave me. I took it to school during primary. Like, it involved things like I was not supposed to be beaten. I was supposed to be wearing a sweater. Like, I shouldn't go for PE, and then other things involved like not being stressed generally. So, but then this other social kind of life, like when it happened to getting friends, I wasn't so good at it because I was often being discriminated at school, because most of them were asking themselves, why isn't she getting punishments? Little did they know that I was a sickler. I couldn't get beaten or something like that. So they used to hate me for that, and they used not to play with me, which I was fine with it because I had a friend called Sarah. She could be there with me. We could pray, like she could do my homework sometimes when I get sick, because I often had attacks and I was taken to the hospital. But then later on they taught my mom, my sisters on how to handle me when I get the pains like at home. And they used to put hot water on me. Like they get a towel, they soak it in hot water, and then they put an area where there is pain specifically. They could give me some tablets, then they could cover me. And life at secondary, it was not easy, it was so tough. I want to advise youth out there, if you really want to be like me, because I'm a proud sickler, please avoid drugs, avoid early pregnancies, and please take your spouses for testing.
You are watching the Doc Talk Show.
But at least they go into this knowing what they're getting into.
Thank you.
It's better when you know something than when you don't know and start having
Thank you.
regrets
Yes.
much later on in
Thank
life.
you.
At least you start knowing the future could be this. The future could be good or
that.
bad.
Yeah,
Better
sure.
than not knowing.
No,
Not
the,
being
the
in
worst
that
part.
known.
No.
Yeah.
Most of the parents they did not know. They got to know when they have a child, and that's a challenge.
It's a bit of a
Yes.
challenge. Okay, Dr. Kasiri, I know sickle cell is quite a big disease. You see lots of complications. Are there complications parents should be watching out for, and what they should do if they identify it?
Okay. Thank you very much. Like earlier mentioned, one of the earliest complication or common complication is when they have low blood level. And the parent can actually contribute to getting to know this by looking at the inner part of the eye. So they can
under the eyelid.
under the eyelid. So when it looks pale outside the usual one,
The usual is supposed to be
pink.
a nice pink.
Should be pink, a nice
You know,
pink.
like can
Not
I say
hot
dark
pink, but a nice pink.
baby pink.
Yes.
They call it baby pink. Eh?
Yes.
Okay, but there should be some color under the eyelid.
Exactly. So when it looks paler than that,
Or maybe you could even compare with the other children.
yes.
Compare with maybe someone else at home and see, do they look the same?
And sometimes parents actually see their children appearing lighter than usual. So that should be one of the telltale signs. For the older children, they may even say that they feel the heart beating faster. So that should draw attention to the fact that the child may have a drop in their normal blood level. The other complications, critical complications, any chest pain or changes in the breathing, when the child starts struggling with breathing, that's a very severe complication
And they
of
should
sickle
run to
cell. They should
hospital.
urgently run to a hospital setting. And the third complication is stroke, which manifests overtly in weakness on one side of the body, either involving the hand or the upper limb and the leg.
The legs. Eh?
However, we advise our parents to our dear warriors to be keen. Sometimes it presents in a very subtle way, where with changes in school performance, for example, arithmetic, you find your child suddenly deteriorating, all in language. So those subtle changes may be the early signs of an impending stroke. So if we catch it at that moment and do the necessary treatments, it may actually prevent or even reverse the stroke event.
There's even an abbreviation called FAST for stroke.
Yes.
F meaning the face, you see the child, maybe ask them to smile and see one side of the face, the smile is not good.
Okay.
That can be one sign. That is the F. Then the A is the weakness. Maybe they have a difficulty. One hand is not weaker than the other. They cannot lift things properly. Maybe if it's the writing hand, suddenly the handwriting has changed.
Yes, please.
Something like that. Then the S is the speech.
Yes.
You see in the speech has changed a bit. It's like as if they are, it's not as it used to be. It's a bit slurred, in a way.
Yes.
So that is the FAS.
Yes.
Then the T is the time.
Yes.
Yes, I think that mnemonic first can help parents quickly recognize that this child might be getting a stroke.
And quickly seek.
The T is for the time.
Yes.
It's all about time. Once you realize these things, take the child as soon as possible to the hospital. But otherwise, I want to thank you very much, Dr. Kasiri and Ms. Nagawa, for this enlightening discussion on sickle cell. And in this month of the month of September, being Sickle Cell Awareness Month, we appreciate you taking the time off your busy schedules to come and educate all Ugandans about sickle cell. As we conclude, any parting words? We always like to give parting words. Those last tips, the key message you want which one viewers to remember. We'll start with you. Mistress. Yes.
It's September. Well, we are making noise for sickle cell, and I want to encourage people, please test for sickle cell. It is a very dangerous disease. We want to reduce cases of sickle cell. How? We test, we get to know so that we avoid having these children come into existence. So please.
Just test.
Please, and if you know, if you're already there, please, it's not only yours to make the noise. Now you've had the information. You know what sickle cell is. Please preach the gospel.
Others.
Preach the gospel. Preach the gospel. The more we work together, the more the world gets to know. The more we fight for sickle cell, the more lives are better for the ones that already have the disease. So please make noise. Come to our offices at BMK House and get more information. We are always there Monday to Friday. We work from 8 to 5. Please feel free to always walk in the office and ask any question about sickle cell, and we will be able to give you every and each information that you need. And the other thing is I want to thank our sponsors, Board of Director, BMK Group, Hotel Africana, Roofing. I want to thank AGT, and above all, I want to thank you for this opportunity.
Yes.
This is a wonderful opportunity for allowing me to talk about this issue.
Yes, and we also appreciate you and the Sickle Cell Rescue Foundation for what's most important for us is health dissemination, health prevention. So when you come out to educate people about this disease, it really creates pause. Thank you, Tracy. So, Doctor, any?
The key thing is that we need to care about sickle cell, and therefore care to know our status, as well as those around us, and care to link our children to care, because it does help. Thank you so much.
Care for yourself, care for your children, care for your future.
And your
future
neighbors.
children. All right, so you heard it from the guest today. September is the Sickle Cell Awareness Month. You've listened to the experts in the field, and they've told you everything about sickle cell, the do's and the don'ts, all those tips. Make sure you adhere to this advice, and you could possibly save. you could help a family that is suffering from this, that's struggling with this condition, and help them live a much better life. So thank you very much, our guest doctors, and we'll see you next time on the Doc Talk Show. Remember, you can send in your questions on our social media platforms. We'll be so happy to hear from you. As for now, till next time, goodbye.